Okay. Hi, everybody. My name is Sandra Nieves, and I'm a public health nurse, a registered nurse with Lorain County Public Health. And I have been, as of late, being part of the vaccination clinics where we're administering the COVID-19 vaccine. Routinely or normally, I am part of the immunization team here at the County Health Department. And so I see people of all ages for vaccines. And so today I just wanted to talk to you a little bit about how to stop this, how to how to stop the pandemic, and in essence, and one of those ways again is by being vaccinated. Believe it or not. So we're going to talk a little bit about the COVID-19 vaccine. Next slide. Next slide.
It's not going. Hang on.
Okay. Oh, one too many. Okay. Studies show that COVID-19 vaccines are effective at keeping you from getting the COVID-19 disease virus, and that vaccines will also help you from getting seriously ill. So very important tool in getting back to normal is a vaccination. So it's important to get vaccinated against any and every disease that there is a vaccine available for, but we're talking about COVID-19. And so, but even after being vaccinated, there are other measures and other tools that you can utilize. Because the vaccines don't kick in right away, it takes about 2 weeks for you to get protected initially. You still need to use masks, and you still need to social distance, and you still need to use good hygiene, hand washing. It's very important. Next slide. So again, COVID-19 vaccines, just like all vaccines, had to, go through the same safety standards as all vaccines. The difference is that these what we call emergency use, because where some vaccines or most vaccines, it's years of trials. This one was a period of trials, a shorter period of trials, but nevertheless, they had to go through the same standards and safety measures as all vaccines had to go through. Next slide. There are 3 known or licensed in the U.S., and 2 of them, the Pfizer biotech and the Moderna. These are vaccines that are known to be what we call mRNA, or messenger RNA. And a messenger RNA vaccines, they take a little bit of the vaccine, a messenger, it's a technology that delivers a little bit of the code of the vaccine to the cells, and it teaches our immune system how to develop antibodies to fight the virus. And these 2 are made very similar, Pfizer and Moderna. And then there's the Johnson & Johnson, and the Johnson & Johnson's use a different approach. Okay, it instructs the immune system to make antibodies, but it's known as a viral vector vaccine. And that means that it uses the genetic code of an adenovirus, but it's still a killed virus, something like the common cold. Adenoviruses are like the common cold, and that teaches the body to make the antibodies. So all 3 are to fight the virus, okay, to help the body develop protection against the virus, but they're just made differently. Next slide. Okay, Pfizer and Moderna, again, vaccine are 2 doses, and the spacing between them, the Pfizer, 21 days between the first and second dose. The Moderna is 28 days. Like I said before, the first dose gets your body ready to protect you. It's what I call it, primes your body. The second dose actually gives you full protection long term. Next slide. The COVID-19 vaccine, again, told you a little bit about mRNA vaccine. The vaccine cannot give you the COVID disease. It does not use live virus. It's just, again, it's a genetic code to the cells, and it teaches our immune system to develop antibodies. It does not interact with our body cells, our DNA. It never enters the nucleus of our cell. and the cell breaks down. As soon as it makes the antibodies, as soon as it does what it needs to do, it actually gets rid of it. After the vaccine does what it actually gets rid of it. The Johnson & Johnson, again, it's just a little different approach, the way it was made. This is what we call a viral vector vaccine. That means that it uses harmless adenoviruses, like the common cold, to cause the body to make antibodies to protect you against the COVID-19 virus, okay? Again, it's not a live virus. It can't give you the disease, and it doesn't cause your cells to interact in any way, the DNA. All it does is it builds those antibodies. It teaches the body to protect you against the COVID virus. Next slide. And then we have now, we have a new system that you can go into you can go into our website, LorainCountyHealth.com coronavirus, and you can find a provider. You can find someone to help you get the vaccine. Next slide. Or you can actually sign yourself up for the vaccine. You can make your own appointment. Next slide. And again, you can go to LorainCountyHealth.com coronavirus, and it'll actually talk you through how to make an appointment. You can do it yourself. That we've also partnered with different agencies. We've partnered with El Centro. We've partnered with Office on Aging, and also can help you if you can't figure it out to make an appointment through ArmorVax. And keep going. And again, you can schedule your own appointment. You can schedule where you want to go, because the clinics that are available will come up. And then you can also schedule the kind of vaccine you want to get if it's available. So right now, and we are subject to what the state sends us. And right now we have a lot of Moderna, so our clinics are mostly you're gonna see now and to the end of March and April is gonna be Moderna, because that's what we have the most of. There are some clinics for Johnson & Johnson, and we're giving second doses of Pfizer because the state hasn't sent us any more Pfizer. So we have enough vaccine to vaccinate those people that we gave the first dose to. Next slide. And again, there's 3 ways to sign up for an appointment. You can use the ArmorVax app. You can go online, call us. You can call El Centro. You can call the Office on Aging. Our libraries, Lorain City Downtown Library is set up to help people make appointments, just like the South Lorain branch. Or you can call 211, which will connect you to someone who can help you make an appointment. Again, even after you get vaccinated, I had explained that it takes about 2 weeks for your body to be primed. And then after the second dose, it takes about 2 weeks to be protected. So in the meantime, you should keep wearing your mask, covering your nose and your mouth. You should continue to wash your hands often and continue to maintain that social distance of 6 feet. We know that not everybody can get vaccinated right away, so these measures are very important for us to continue to implement. I think that's my presentation. Thank you. Any questions?